I am Lilia Hernandez. I graduated medicine at the University of Santo Tomas here in the Philippines.
I'm Betty De Castro, dentist by profession. I am with the Visayas Primary Healthcare for 32 years.
I am Dr. Erlinda Porsadas. I am a medical doctor.
I'm Juliet Abging from St. Mary Grace, Talamban. I'm community health worker trained by Visayas Primary Healthcare.
I am Dr. Rosali Bajado. I am a practicing homeopath.
Hi, I'm Lourdes Geolin. I've been working for Visayas Primary Healthcare for since 30 years.
My name is Angelie Marangga from Pasil, El Flores Street, Lawis, Pasil.
I'm Lourdes Geolin. I'm office and medical assistant.
I'm Cres Labitad, the administrative officer here in Visayas Primary Healthcare.
I'm Irish Grace Ramirez. I'm a nurse in Visayas Primary Healthcare Services.
Community-based health programs now is very much different from what it used to be. Now, a group like VPHCS will not enter a community unless a community organization asks for them. So it's usually you have a farmers group, you have a fisherman's group, you have a youth group. Many times it's a mother's organization. So there are already organizations in the communities. So now every group will have what you call a health committee, and they, if they realize they need a community health worker to be trained, they will call VPHCS to train them. Now, the function of community-based health programs like the Visayas Primary Healthcare Services is not only to train now, but to render healthcare. And they render services when, like, if there is an outbreak of dengue in an area. So they go into the area if they're requested by the People's Organization. They train community health workers. They give lectures on how to prevent, I should not say lectures, actually they educate. Not so much to lecture, but to educate the people on the prevention of dengue. And I mean, something like that. So they are requested for a called medical mission. If there is an outbreak, let's say, of respiratory diseases, they go in there and they bring in doctors, volunteer doctors. These are local physicians who will come and volunteer and render free service to that area. They, of course, bring medications. Either they buy those medications or they get donated.
We in BPHCS always dream to have healthcare to be accessible, affordable, and scientific to those people who are deprived and oppressed, meaning deprived of food, shelter because of poverty, and to access of medical services. So our main strategy is to promote primary health care. So our strategy is one, to train the people. Secondly, we provide medical services if the community is needing it. And the third one is we are giving an awareness raising for this medical health sector. So the health students, so that when they graduated, they can be sympathetic or they can provide free services to these deprived communities we are covering. And the fourth one is we have a resource generation like Balay Kahimsog, which is part of our resource generation.
that's what we call primary health care. So primary health care, people know what to do, how to take care of themselves, how to keep themselves healthy. It's actually more of education in primary health care that I'm really concerned with. That's why I'm a different doctor. I don't treat people when they're sick, but I keep people healthy. I don't want them to become sick.
I'm happy to serve people, the poor people like me. My work is how to teach the herbal medicine and how to cook herbal medicine to the community.
We also have the student integration program, which is I am the one I'm assisting the students to go to the community, letting them see the real situation of when it comes to health here in the Philippines, and how their services, their skills, their knowledge can help the poor people in the communities.
I met with one of the founders of community-based health programs in the Philippines. That was Sister Mary Greno. Community-based health program in the Philippines started in 1973. This was founded by 3 nuns, Sister Mary Greno, Sister Eva Boal, and Sister Xavier. And they got funding from Miserior in Germany to start in 3 pilot areas. The main concept was to go to the people, learn from them, adapt their practices, and make healthcare accessible, affordable, relevant.
Wala kang itagaan single.
They have several prongs. They have this community clinics called medical missions. They have training of community health workers. They have outreach to medical schools and nursing schools so that they are able to, those who are interested, be immersed in this kind of healthcare approach. They have outreach to academia, so the local physicians and specialists and even politicians, they join forces with them. They work with squatters, those who have no land. I should not say for, they work with, because always these people are organized and they just kind of help with them.
So, for example, in Cebu, we are in Ermita Pasil and St. Mary Grace in Talamban. And then we are also in Tagbilaran in Bohol. So, our former communities are Trinidad, Bohol. Our Resource Gen Center in Baclayon, where our training center is being built in, supposedly for sustainability of the organization. We have a lot more to do with this center to cater for the trainings of the community health workers and for the other groups to use it, because we have a modest facilities, but we wanted it to be improved so it can be more comfortable for the users. So we are accepting donations, grants for the center to be more functional. So actually we are writing friends and networks come and see the training center so they could see it themselves, and hopefully they would donate some grants for this center.
I still believe that there is still more room to be worked on as far as having a more personal approach to healthcare. The Visayas Primary Healthcare Services now uses both indigenous healing practices, Western healing practices, and homeopathy. So much of this I actually learned from a homeopathic doctor that VPHCS has befriended. He's a homeopath, and if you are a Western-trained physician, homeopathy is another revolution of the mind to accept. But one thing I have gotten, there are many things in life that you cannot understand. You concentrate the dose in a small pill. It seems impossible if you have a Western set mind, but if you think about metaphysics and quantum theology and all that. So homeopathy, my approach to it right now is I believe it, I respect it, although I don't understand it. I really do. And so, and I think if we can have more people believing in it, convincing people that there is an alternative medicine, I think healthcare will be much more affordable.
Homeopathy is very, very cheap, very accessible, but I do not sell it because Norbert always tells me we do not sell it. We only give it because that is what the poor needs. I have to take care of my sick father because I felt so sad, me being a doctor, and I cannot take care of my own father. So I went home, took care of my father, but he was given this conventional medicine. My father doesn't believe in homeopathy. So with all the illnesses that he has, I gave him the conventional medicines which he wanted and only alleviated the condition. So one day he said, okay, I surrender. I will try homeopathy. Indeed, I gave him homeopathy, and it took some time, not right away, because it's not like the conventional medicine, which the effect you would see the day after. But this one, it took about, say, a week before he started to feel that he is getting a bit better, and then kept taking it better and better. Until my father went back to his old self, his healthy self, with homeopathy. That's why he was advertising homeopathy that time. But nobody understands homeopathy. They do not believe that. But if we say it's some kind of homeopathy is some kind of magic medicine in the Philippines, they can relate. It's not easy to convince those people in the community that it really works. That's why we are very thankful for Norbert to be here and to teach us. He has gone so far and I have to learn a lot from him. And I know that even after several years, I still will not be able to absorb what he has in his brain.
Saying you watch the sclera is blue. Right? See? And she looks at you see the sclera is blue. For me, the importance is the approach to these people who are, belong to the 85% of poor. So formerly I had a difficult time to heal children. The question for me was, to what kind of future do I heal these children and youngsters, considering that 80% of this population is under 25 years of age. It's amazing, But with the time, I restrict myself to my professional ability. I just care about them, as a human being, and make people healthy as much as you can.
I want to be a doctor, and I am hoping that I will be, or I have a courage to be a homeopathic doctor someday. And if I will be, Dr. Norbert Enders said to me that I will be the first doctor of homeopathy in the Philippines. I will graduate with a working student, and I am also given scholarship by Dr. Norbert Enders. So from now, I am going for also medical missions, psychosocial events, and circumcisions.
In the Philippines, like many poor nations, you only see a doctor if you are dying or dead. Many Filipinos still die without having seen a physician. And so what I have brought to them was my practice. I'm a pediatrician in the United States, where you try to see them before they're sick. We have had several cases when we did these physicals, and we found out that the children have heart murmurs that they did not know. And so we have picked up some kidney infections in these well-checked physicals. And so that's where I think we should be going in more. When they go to training at 2 weeks at a time, who plows the field? Who reaps their produce? The community did it. So if this time for this farmers' farm was to be planted, all the farmers would go there to plant his field while we were in training.
By primary healthcare, we say that we have to educate the communities on the preventive aspects of health. So we have, if there is problem on nutrition, you have to teach them. Everyone should be treated, ever if you are poor and in the middle strata of the society. What is the nutritious food?
Filipinos think that you should buy multivitamins rather than buy food, buy this nutritious drink which you only pee out anyway because there are only vitamins that you can get in food. We don't even want to cook anymore. 30% of Filipinos are stunted. That means chronic malnutrition that has prevented them from growing.
The drinking water, there is a supply, we call it Metropolitan Cebu Water District, so everybody who get water will pay for the main caretaker of the faucet. Like, for example, in Pasil, they have a communal. So there is one pipe, and members of that particular sitio, they pay for the maintenance and payment of that faucet. But before, they have to carry on outside just to get water. And like in Pasil, you can see in one shanties there are three families, because that's the sister or that's the brother of the mother and the children. So they are compressed in one shanty. They share with one or two restrooms who is being used by other community residents. There are tricycle drivers also, just to augment the income for the food of the family. Family of 6, family of 10, whichever. So that's how life is in community slums. They are saying that they can pay some rent in a meager and then installment basis because the government has a plan for development on that particular site. The government is trying to resettle them, but no resettlement area is being offered yet. And the people usually doesn't like the resettlement because they will be away from the source of income, which is the carbon market. So they tend to say that the Philippines is already very rich, and meaning that behind those high buildings are the poor people. The squatters had been demolished just to pave way for a certain activity of the government because they want to project a very highly economic boom country, undermining what are the needs of most of the majority, the 70% of the poor people who are behind those high buildings. my fulfillment with my work is just being happy, because when we can help other people and seeing their happy faces, it seems that we will be. You are also lying down happily on the night after the work, and even a simple thank you can always energize, even if we are very tired when we go to the communities.
And I inspired to work for the Visayas primary healthcare to help the poor people, and their health is my health.
One reason why I'm staying here for 30 years is to help the poor people, no, in the urban poor communities, the peasants, the fisher folks, the basic sectors, because we see that these persons are very poor, depressed, and need support services, health services from us.
After I graduated, I worked in the hospital, but I choose to work in the community because I saw the need. I saw that I will be more effective and I can help more in the communities. It's the joy that seeing them manage themselves in sickness and their illness.
I think that they still need a lot of support for this, because they do not earn much as a physician, as a nurse. They don't earn much, but they do need to live. They have families. They have some of them still go to school to increase their knowledge, like a master's degree.
This can help us for our programs and services, to sustain our programs and services. Although, as you see, it's still under construction, so we still need some more of the donations we can make, so this can be, the amenities can compete with the other.
I'm calling on doctors, nurses, health students, all professionals and all well-meaning people to come here to the barrios, to come here and serve and give your time to the barrios. The problem really is education. People need to be educated, need to be taught, or need to know how to keep themselves healthy. So we're calling on all educated or just any simple, ordinary people who love to work with poor people to come here to the grassroots and serve people here.
One of our program services is to generate finances, because if there is no finances, we cannot continue our health services, no, towards the needy people. That's a big challenge for us here in the office.
We really need help, because Visayas Primary Healthcare is an organization that will help the people, that will serve the people, and can heal the people.